Welcome to our Medical Education Symposium panel discussion. And the panel discussion title is Innovators Stories of Creativity. And we're fresh off of a phenomenal talk by our plenary guest speaker, Jay Baruch, who really gave us a real provocative set of points for us to ponder as it relates to creativity, our role as clinicians, and really really reminded us of how being open and in our journey towards being an innovator is something that we can embrace through the arts. And so I'm very thankful for that. And we're really happy to have this panel discussion where we get to ask him more questions and ask a couple of our other panelists questions as well. So why are we doing this panel? Well, it really is because innovation is not a straight line. And I want everyone to pay attention to the title of this panel is focused on stories. And as Jay said, getting the story right and asking the right questions is really critical. And one of the most powerful influences on innovations is stories. I don't know if people have had the chance to read this book. I'm just going to put it up here. It's called The Heart of Change, and it's written by John Kotter, who's a professor of business at the Harvard Business School. And he talks about how organizations change and innovate is not through data, but through actually the telling of authentic stories about both the warmth and the difficulties of our collective journeys. And he studied this through multiple corporations. So that's what we're going to focus on today. I'm really grateful to our panelists who have agreed to join us to share their personal stories as innovators in education, including all the twists and turns and detours and even disappointments. So you're going to hear from them today, and each of them, I would ask you to keep in mind that each of them is sharing authentically what their road is like. We all have had the twists and turns. It's never a straight line, but each of them have big ideas on how to transform learning. And I hope that our stories that we draw out from them allow us to be inspired to move forward with our own ideas. So just a housekeeping issue. As the panel responds to some questions, I'm going to invite you to place questions and or comments in the chat room. We're going to have about 15 minutes for Q&A today out of this 45-minute panel, because I have some questions that we're going to be going around with them. But they can be addressed. The questions you pose can be addressed to individual panelists or to everyone. Just put a little indication with an @ sign who you want the question addressed to, or if it's to everyone, just put @everyone. If you want to just verbalize your question instead of chat, just put an X in the box like I am doing here, and then I'll be sure to call on you when we get to that portion of our panel. So let's get to the panel. I'm really pleased. We have all met Jay, who serves as a professor of emergency medicine at the Warren Alpert Medical School and Brown University, and he's director, as you heard, of the Medical Humanities and Bioethics Scholarly Concentration. As you heard, Jay is pushing innovation as an educator and creative writer, and challenging us to think differently about medicine and ethics and design and teaching all at once. And as you heard, his academic work focuses on the role of creative thinking, creative writing skills, and the arts in clinical medicine. And he's very active in interdisciplinary work and interinstitutional collaborations. So that's his big idea, and we're gonna come back to him. But thank you, Jay, for joining us today on the panel. Our second panelist is Dr. Brian George. Brian is an assistant professor of learning health sciences and surgery. He's an acute care surgeon at the University of Michigan and is actually a former software engineer, someone warm and near and dear to my heart, that field. He's an award-winning educator, and his academic interest is really focused on how we can improve the system of medical education through many different means, including the use of large and meaningful data sets for performance improvement in the surgical field. Brian, you want to give us a 30-second thumbnail of your big idea?
Yeah, thanks, Raj. I appreciate it. Thanks, everyone, for organizing this and showing up. Thanks, Jay, for inspiring me this morning. It was really fun. So my goal really is to build infrastructure to accelerate and scale meta innovation. So it's a little bit meta, but it's certainly at the systems level. And this all began when I was a medical student, just like many of you who are medical students, thinking there's got to be a better way. And I still feel that way. I still feel like there's got to be a better way. And I always wonder, like, why don't we have a better way? And certainly it's not a lack of brilliant people. It's no lack of research. It's not a lack of innovations that we're going to talk about today, but it's really about um, a way to scale. It's really hard to scale all these great ideas and these great people. And so that's my work really, is to build the infrastructure to scale improvements. And that comes in two parts. I swear, Raj, I'm almost done. Measurement and collaborative networks. And so on the measurement side of things, I'm in charge of an app that's being used across the United States to measure competence, which is a really important outcome for improvement. And then also helped found a network of 110 training programs that all use that app, but also have agreed to collaboratively improve the whole system of medical education together. So that's it. It's
Wonderful,
called
Brian.
Procedure Learning
So
and Safety Collaborative.
four key words I'm taking away: system, scale, collaboration, and big data. Those are big ideas. Those are not small tasks. Very different than what we heard from what Jay is tackling. So great, diverse couple of panelists. And now our third panelist, I'm really thrilled to introduce Emily Johnson to you all. Emily is one of our fourth-year medical students and is also a Michigan Institute for Clinical and Health Research graduate student, getting her master's degree. She recently completed this graduate program in clinical research and is now finishing medical school this year. So congratulations in advance, Emily. She was a 2019 Dow Sustainability Fellow, and she's been co-founder of the medical student group White Coats for Planetary Health, and a member of the first cohort of RISE grant recipients as well. Her grant is actually centered on this and is focused on building and implementing a curriculum on climate change and its impact on planetary and individual health for medical students. Emily, do you want to take 30 seconds and just expand further on your big idea that's going to inspire you for the rest of your life?
Yeah, well, thank you. It's really an honor to be invited, and I have a lot to aspire to with the other panelists present. But my innovation project, as you mentioned, is really about educating physicians and physicians in training about climate change and its impact on human health, because it will have impacts on human health. And so to do this, we're building an elective course that will take medical students on a deep dive on climate change and also give them the tools to take action. And then we also plan to do some longitudinal curriculum development, so all students are exposed to these topics and find ways to engage with residents and faculty and staff at Michigan Medicine. And I think the innovation for this first part is really around the design. Our course seeks to empower students to become leaders, and so they can have an impact while they're here at Michigan Medicine, and then as they transition to residency and become practicing physicians. I really think that for my generation of physicians, our clinical practice will be influenced by climate change. And so we need to learn how to respond to this. And physicians can be a really important leader in some of the mitigation and adaptation efforts. And so that's what gets me excited, gets me out of bed in the morning.
Wonderful, Emily. And I love that phrase, what gets me out of bed in the morning. We all got to get out of bed in the morning, and hopefully meaningful work is one of the reasons that we do that. So I heard not only climate change, but planetary health and how you bring that big picture perspective to the individual patient. But I also heard empowering students and learners as leaders. And that's a really interesting concept where it's not just about expressing your voice, but championing change. So I know we're going to talk about that. A lot of very different concepts here. So let's get started with the questions. I'm going to go to Jay, you first. I mean, such a wonderful and inspiring and provocative talk. I wonder if you could reflect a little bit about how uncertainty, which seemed to be a really important part of creativity and the skills you're trying to develop, and certainly is one of the innovator competencies, is being able to wrestle with uncertainty and find our way through that. How are you seeing that expressed during a pandemic like this, like we're in the midst of? Are we responding well, or do we have a ways to go? Because it feels like uncertainty may be the word of the year, given what we're all going through collectively as a planet.
Yeah, I think that's a great question. I can't, I don't want to speak for medicine writ large, but I'll speak to like my own little world, and I don't think I don't think we're responding terribly well. I think for a couple of reasons. One is that this is something. First of all, I don't think we handle uncertainty well on a regular basis. I feel like we've had certain defense mechanisms. We've created like false certainty. We've had ways of which we sort of dealt with issues, and we had familiar practice patterns or whatever that we were able to count on. And I felt like what COVID has done is it's totally destabilized everybody, right? So it's not just this disease that we didn't really know much about, when it first came on the scene, to questioning the lack of protective equipment and that the impact on like how we actually even think about physician risk versus just the patient always come first now, when your own risk and what you might be taking back home to your families is at risk, to the idea that we want to do something and we were all doing things at the beginning and then we realized that maybe we weren't doing the right thing for patients because we just didn't know. So I felt like a lot of things that we were trying to do, there was no space that was sort of stable for that. And I feel like that's not necessarily a bet. Like at the time, I think people did the best. We did the best that we could do. Hopefully we did the best that we could do. My challenges and the problems I find is that, as we come through the second and the third wave, I don't know if we're any better at it. I feel like we were all sort of overwhelmed by this and we were exhausted and we were stressed by it. Like I was like personally, the residents, like I felt like I was fine in the middle of the crisis. And then afterwards, after the crisis was over and it sort of wasn't going away, then once things started sort of creeping up. And so I don't think we're prepared for the uncertainty. And I think that we do need to think differently, not just about COVID, but how we operate generally, because the financial stresses put on institutions, our ability to do the normal things now are compromised somewhat because of the financial burdens of COVID. So I don't think we're doing it that well. And but I also think it presents an incredible opportunity. This unprecedented event, I also think also provides an unprecedented opportunity to think differently about what we do, not just related to COVID, but just our normal practice of operation.
Thanks, Jay. And it does get me to wonder whether we as a profession are trained well to deal with uncertainty or to manage it or to sit with it in ways where we're not always moving forward with what the next step is. I think that's a little bit of such an important mission that you seem to have crafted, that could the arts help us manage, sit with uncertainty, find space for that, so that when these crises happen, we're not as uncomfortable as we are and kind of flailing about, as I heard you talk about a little bit sort of early on. I wonder if I could pivot to Emily here to talk a little bit about, because obviously what COVID is doing is it's giving us a better planetary perspective, and it certainly isn't necessarily tied exactly to climate change, but planetary health is certainly impacted by this pandemic, and there probably are ties there. But I wonder, as you think about your big idea, how does uncertainty and helping learners deal with uncertainty fit into your big idea?
Yeah, so I agree. I think that there's a lot in common with what we've seen in the COVID pandemic and what we expect to see in the coming decades around our changing climate. And I think this point about uncertainty is really important. And it's something that we're trying to bake into the course because we don't know exactly how impactful these changes will be, and we can't exactly predict what it will look like. And so rather than giving specific knowledge to medical students, like this is the relationship between respiratory disease and air pollution, we are giving them the tools to interpret this information and then to find ways to address it. And I think uncertainty plays a role even outside of just the medical students. And it's something that I've had to think a lot about as I approach mentors and faculty around this topic. And I can recall one of my first meetings with an important mentor, a surgeon, and a person who really supports medical student projects. And I remember approaching this person with this big idea that, we need to be teaching medical students about this because it will affect their future clinical practice. And I started talking about some of the ideas around what I thought we could do to change the hospital, to change the operating rooms. And I made a suggestion, and his response was, no, you will not be taking that from me. And as you'll not be like changing this environment for me. And as I walked away from that meeting, I remember thinking, oh man, like, is this even a good idea? Should I be doing this? Does this matter to other people? And what I realized is that I hadn't made the case for what we were doing. And so everyone has uncertainty about like what these things look like, how things will change as we move forward. But I hadn't made the case that we need to embrace this uncertainty and to prepare for it in this meeting. And I hadn't gotten on the same level with this person about what I perceive to be the importance of this topic. And so I think uncertainty is definitely a part of teaching medical students and residents and faculty about this topic. But it is also something we have to grapple with as we try to make the case for what we're doing, because everyone feels so much uncertainty around it.
What a phenomenal point, Emily. And I really want to just thank you for sharing that. I mean, I think all of us who have had ideas, we've been there where we're wondering, is it me? Is it them? Or what is going on here that this isn't resonating? It's almost, and I'm always reminded about the power of putting yourself in the other person's shoes and not knowing. Sometimes we assume that our idea is fairly easy to digest. And so I really applaud you for going back and then thinking, have I made the case? And in such an uncertain world. I wonder, Brian, if I could pick your brain as well. I mean, you're working with national collaborators, big data sets. Were there times where you were really worried about you haven't made the case yet? Or there are times in your innovator journey where you're like, wow, as Emily said, maybe this isn't something I should work on because I don't think I'm getting resonance here.
Thanks, Raj. I mean, I think those are two questions really, right? It's one is like, do you have your elevator pitch kind of thing? Can you explain it to people? And the short answer is no, absolutely not. I still struggle so much. And then the other one, I don't know, it sounds like, what kind of challenges kind of stuff in general. And I guess I'll focus on the first one because I think it resonates with what both Emily and Jay were talking about. And Jay, in your talk earlier, I think that word empathy was, to me at least, the most important part of that talk. Because if I think about empathy, I think about, again, what Emily, you were saying, like going back to where they're coming from, understanding what their priorities and values are. Obviously, you have a vision and a goal for that conversation, but trying to align your understanding of where they're at with what you're trying to say. So I remember I was invited to do two video interviews within the span of a month. And I prepared for them by writing out a script of what I was going to say, trying to get my message across, and I did both of them and I felt very proud of myself at the end. I had never done anything like this before. And I was like, oh, that went great. Like I was so articulate and charismatic and it was amazing. And then like a month later, I heard from one of them, they were like, yeah, one of them was from a communications expert. They're like, you know what, we really could help you with your, elevator pitch. I watched that video again and you could really use some help. That was like a very gentle criticism, but totally true. And then the other one was like 3 months later, we were in a large meeting, a lot of people, and they were using me an example of how they'd done this video. And they're like, oh, and we noticed, some people need extra practice. Like, cause like I was talking to Brian for like the first 30 minutes of my interview with them. Like, I didn't know what the hell he was talking about. And I was like, oh, I guess I didn't nail that one either. So it is hard to tell. So as an innovator, it is hard to tell this story because you're ahead of other people. they don't get what you're talking about because it's a new idea. That's the whole point, right? And so like, how do you relate the new to the old in a way that doesn't take an hour? Because no one wants to listen to me for an hour. And I don't think I've cracked that yet. Like, I'm still like, the intro I did today was a new intro. Like, every time it's brand new because I'm just like still trying to figure it out.
Wow. Great reflections there, Brian. And thanks for sharing those. I definitely have been there with you, thinking I've gotten my point across and realizing everyone is confused. Jay, can you pick up on that a little bit? You are in a very different space in medicine, in academic medicine, and certainly in medical education. You must have had to try to convince people that your idea was something worth investing in. Maybe it was Brian you had to convince. But I wonder, can you describe some of your stumbles and what you learned from it that then gave you the platform to do the great work you've been doing over the past 10 years at Brown and before then?
First of all, I mean, yes. So first of all, I want to just pony on a few things that Emily and Brian said, and I think because their experiences so resonate with me. And I have to tell you that I can't talk about struggle in the past tense. I struggle to this day. To this day, I have things that I'm like tired. It's exhausting. It's exhausting moving things into new directions. And so one thing I think we have to sort of first acknowledge is that we can all talk about creativity. But the truth of the matter is that people love creativity in retrospect. When they've had a creative project that actually succeeded. Most middle managers or most people in institutional positions of power don't like creativity because it pushes them, and there's been a lot of writing in the business literature on this, because it forces them into uncomfortable places. Most people want conformity. And if there's a choice between with a risky new idea that's going to move things forward versus something else that's not necessarily as great, but it's a more comfortable one, the more acceptable one, the one that we can sort of settle on, they'll take that one. So we have to recognize that the whole process of creativity is really, really hard because most people don't want to tolerate it. And I've been in so many meetings where people go, that's a great idea. I love what you're doing, but they don't want to support it. They're very happy to take credit for it when it succeeds.
Yeah.
But so like I'm struggling to this day. And I think what Brian talked about, which was so true about like different levels of getting it. Like and there's this idea of like sort of the tyranny of knowledge, where because you understand it, you know what you're trying to do, why this is really important, to actually realize to put yourself in the mind of others their brains might not think that way, who might not quite understand it, and it seems so obvious to you. Like you're sitting there going, it seems so obvious to you. And who you work with people who also it's so obvious to them. And so the conversations that you have amongst each other that you like, yes, you don't get. And I actually had a medical educator who at one point I was having coffee with her. This was like many, many years ago. I gave a talk and she goes, you know what, now I get what you're saying. And I thought she was like one of my allies. And she's like, now I get what you're doing. Then like 2 years later, I did something else. And she was like, now I really get what you're talking. And then like a couple of years later, she was like, so like I talk about the different levels of getting it. However, I must tell you, it is exhausting. It is exhausting. And that's why I think you have to be passionate about what you're working on, because there's going to be a lot of people who are going to say no.
Yeah.
Who are going to say no until you find that person who says yes. For me, that was Brian. There's absolutely zero way that I'm sitting here before you today without Brian. Absolutely not.
So I'm hearing a real theme of perseverance and using the inner passion of what gets you up in the morning to push through, in order to be able to kind of to find your way. I'm wondering whether Jay, you talked about who are your partners. Yeah. You mentioned that in your talk, and I wonder if I could get any of you to reflect on Does a diversity of your partners help? In other words, Jay, you're almost describing a bubble that sometimes we live in as innovators in academic medicine. Does the diversity of partnership help you refine your pitch, state your why, and get people to buy in? Maybe I'll turn to Brian first. Give me a sense of how diverse are your partners, and does that help?
Yes, definitely. I've built my whole team around this idea of multiple dimensions of diversity, and I definitely think it improves quality. It definitely slows things down, and that's the necessary trade-off, I think. But as you were asking that question, I was reflecting, what's the right number at what level?
Right.
When all this started, I was kind of alone. I had great mentors and everything, but I was up in the middle of the night coding and doing stuff that only I was doing. And then I met one of my co-residents was really interested in this idea too. And we kind of became a dynamic duo in creating this giant network of institutions. And it was great to have one person because we had a shared mental model. It was pretty fast, but not too fast, if that makes sense. You could bounce ideas. So I think it depends on what, but now a lot of the work I do is really creative to me. It feels very painful, Jade, what you're saying, it's incredibly painful, way more painful than the early work. And so having more diversity in that setting, I think it's important. So I guess what I would say to you is if you're in a more execution phase of the innovation, then probably having a smaller, less diverse team might be useful actually. But I think when you're in the innovation phase of the innovation, it's probably smart to make sure that your team's diversified in order to make sure that you have empathy for all the other people who aren't in your team.
What a great point, Brian, and great to be able to say one model is not the same depending on where you are in the phase of your innovation. So thinking about implementation as an important phase, really critical for us to be thinking about, and who's on your team at that time. I want to pause here and just remind the audience that feel free to put questions in the chat room. We're going to be moving to sort of the audience participation of our panel here today. I saw a comment from Steve Lieber, who said that we're actually maybe more comfortable than our patients are, and how we really bring our patients along to deal with the discomfort of uncertainty is really an important skill set, and how difficult that must be if we ourselves are uncomfortable with uncertainty. How do we help our patients? But maybe we're better than we think we are. Such a really great point. Emily, I'm wondering if I could turn to you and ask you to just reflect a little bit as questions are coming up in the chat room. It's a struggle. I mean, you're really trying to focus on an element that hasn't traditionally been in medical education. Have you had moments of joy during the past years that you've been working on this that really keep you going? For me, it's like golf. I just get one good shot, one good tee shot, and I can have 17 bad tee shots, and I'm back the next round. Is there a beautiful moment that you can describe for us that really keeps you going?
Yeah, I would say sort of a recent moment, and maybe this is how a model I've had to make for myself to get through those harder moments is just recently in September, I was on a sub-I. I'm submitting my ERAS applications. And then on top of it, I'm trying to manage all these little details, like coordinating people and Zoom calls and schedules to put this course together that we want to be really impactful. And it was just totally overwhelming. And I think, one of the days someone had asked me, what does this say you're doing? What's going on? And I had a chance to take a step back and tell them the grand vision. And it was just so motivating to see, first of all, how far we had gotten in this project when we considered where we're headed and where we had started. But it was also a moment to reflect on these little details and problems and barriers really weigh down your day-to-day experience. But taking a step back to remember what you want to create and what you think is possible I think brought me some joy, or at least brought me some clarity about where we're headed. Otherwise, like some other moments of joy have been those moments when a person who wasn't really getting it, who wasn't really on my side, like changed their tune. And going back to the previous example I used of this prominent surgeon who was like, no, we're not doing this. It doesn't make any sense. Months later, after some other conversations and some other things that were happening in his own life, he had completely changed course. And we had another meeting where he was like, oh my gosh, I get it. And you're right. And this is really important. And we need to start moving now. And he's become like one of my biggest supporters, or the biggest supporters of this project and this idea. And so those moments of joy are sometimes when you get someone, when you make the case in the right way, I guess, which is like kind of what we were talking about. And I think that what Dr. Brock mentioned is this person you've been working with is like, oh, all right, yeah, I get it.
Yeah, and what an interesting distinction, Emily, between your story of the I get it moment from someone who wasn't necessarily an ally, and Jay from someone who was an ally, but really more deeply understood. And I would imagine that, even though, Jay, that might have been an eye-opening moment for you, it's also a joyous moment because you realize that people are more deeply getting into the world that you have crafted. And so and that can be a really important part of an innovator's journey. So great stories there, Emily. I want to get maybe to a question in the chat. Brian is asking a question about resources and how, the traditional fundings for grants are often based on incrementalism, where you actually build on the previous grant, improve it, and that because of your previous success, you are more likely to get funded. Innovation, you may not have a track record. There may not be a space. You're sort of in this green field. And so it's more difficult to find traditional sources. I think maybe that's what and especially with things being constrained. Maybe I'll turn to you, Jay. Do you have advice on where innovators should go to for funding?
That's what I'm trying to figure out right now. So
Brian mentions philanthropy, or should institutions start actually slicing off part of the margin to say we're going to devote a certain percentage to creativity and innovation rather than feeding it back into the machine?
Yeah, so that's been something that I've been working on, and we got some degree of philanthropy. So years ago, I got a philanthropist to give a seed grant. We made a pitch, and he gave us a seed grant, and then several years later we actually got a larger amount of money for the work that I don't necessarily see because it goes to larger coffers. But I think that there are people who are very interested in trying to fund these things, and because I feel like there's a lot of people out there who want to who realize that things are not operating as they should. And I find that what's kind of really hard is that when we're moving things forward, we're trying to think differently about processes, about curriculum, about how we're educating, or how we're talking about practice. What we don't always realize, and which I discovered too, and I'm sensitive to, is that we're also telling certain people that what they're doing is not that great, or is not enough now. So you have to sort of straddle that line between saying, listen, this is what I think we need, while also not sort of pushing off the very people who, you don't want to insult people by moving things forward, by making a judgment about how it is now. You're just saying that these times are changing and that we need to change with them. So I think philanthropy, I had some statewide grants, arts-based grants. And so the thing about arts stuff is that we're not always looking for a lot of money. So I can get smaller grants. I can't get tons of grants, but I can get a lot of smaller grants. We're presently working on a couple of bigger grants right now.
That's great advice, Jay. And I want to capture a couple of things you said. You talked about the seed grant, which may be surprising, but people should know the NIH has seed grants that they put out sometimes for things that are startups that can be innovation, and those are still being funded. Oftentimes having small pots of, it doesn't necessarily take a lot. So that's really an excellent point as well. In philanthropy, sometimes the donor with the right pitch is the match that you're looking for around the idea. I want to turn to Brian on this a little bit. If you could maybe share, because Brian, you've actually been able to secure some funding that's more, I think, more traditional. And I wonder, is there a way to convert a creative idea into something that could get more traditional funding?
Thanks, Raj. I mean, this is a really important topic because if you're going to sustain innovation, you need to pay for it. And Jay, like you, this is my current worry. And I kind of laughed because I was thinking, I think it's probably going to be my always worry. I'm pretty sure. So yeah, how do you fund some of this? Well, I'll just tell you my story at least, and maybe there's some generalizable principles there, which is, this all began with an app that solved a problem that people were willing to buy into, essentially. And it was personal relationships. It wasn't like we went out on the marketplace and sold it. We called our friends and say, hey, we have this idea. Does your program want to do it and help support the funding of it? We raised, I think, $300,000 that way, just through internal funds, but across a network, right? Because we said, hey, we need to assess competence. We don't have a way to do it. We can build this, but we need like a lot of money. And everyone said, okay, let's try that. And then the American Board of Surgery funded a trial. They didn't fund the development, they funded a trial to study the implementation and results of that. So it met their needs for like understanding competency. So, and that sounds like a lot of money, and it is a lot of money, to be clear, but it's not that much money. I can tell you it's not that much money. And then once we built this network, everyone continues to now, that whole effort, to build infrastructure to scale is sustained by the membership. And so we always try to make it as cheap as possible. And it's gotten cheaper over the years as we've grown, but that's an ongoing source of funding for innovation. Actually, that's like, they're really kind of paying for the solution of their competency assessment, but we always tell them, actually what you're paying for is this big vision. And they're pretty bought in, honestly. They stick with us. I don't know why, but they do. It's awesome. So we have 110 members there. It's, the membership costs vary, but it's, on the order of thousands per program. And so you can do the math. It's a reasonable funding. It's enough to sustain a small organization. And then the next big chunk of money I got was internal at U of M, the GME Innovations Fund. And if you guys don't know about this, you should. Larry Gruppen talked about this during the DLHS brown bag one day, and I was like, oh my gosh, this sounds like a great opportunity. It has been. The amount of support I've gotten from that fund has been really instrumental to accelerating all this work and like figuring out how to analyze Medicare data. It's taken us 2 years to figure that out. I couldn't fund that. I can't get a grant to figure out 2 years of learning Medicare data. And I guess the more traditional ones, which is probably what you're thinking of, Raj, is like Stemler Fund. We have a Stemler Fund grant. And that sounds great, and it is great. Like, I don't mean to say anything else. It's great to have money, and it's great to have to me at least, that's a prestigious grant. I'm proud of it. But it's actually not that much money if you think about like the order of magnitude. It's like $150K, and that's funding $1 million study. And so, it sounds good, but we're doing a big national trial as part of that grant, and it has been hard to scrape together the money, frankly, and it's being subsidized by a lot of the consortium, actually.
So great. Nice to kind of classify these and give us kind of a schema and a framework for these. Brian, maybe to end your question, it does seem like the University of Michigan is reserving part of their margin to create innovation funds, but the key question is going to be sustainability of innovation support during lean times. We are not in a bull market. We are in a bear market. Is innovation part of our strategy or not is somewhat going to be walked by how does GMEIF, CMEIF, RISE, and others, how do they get sustained for this time? I want to pivot topics, if that's okay, because Mark's writing something very thoughtful in here about uncertainty not being new to the human condition or to the field. That we've gone through big upheavals in the past. Sometimes we've done it well, sometimes we've had social unrest. And I guess maybe I'd ask you guys to put on your hat as innovators and think through, especially and use the lens of your idea, being in the midst of this upheaval, this time of upheaval. How are you thinking about adjusting your way forward, given what we're about to go through? So it's not exactly Mark's question, but I'd like to actually frame it in the lens of your personal stories. So thinking about, Jay, let's start with you. Your idea of creativity through the expression of the arts. As we move through this pandemic with social upheaval, is it making you think about your idea differently or your role in that idea differently? Or are you just moving forward saying, we need this even more?
That's a great question, and Mark's comment is spot on. I will tell you that, I'll just tell you a little bit about my own personal response and how my work has responded to this moment. And so I feel like a lot of times the work responds to like a need, a specific need, right? A specific challenge. And like, the COVID, our moment is a big moment. It's kind of a vague, all-encompassing moment. It's kind of hard to put your hands around, right? But I feel like my own work. Presently, I'm writing a book of essays for MIT Press based on some of my work, and I'm thinking about the work in context of the moment. And what's interesting is that I feel like the real stories, I feel like the stories that get out, like all are similar stories. Like I feel like there's a lot of beautiful, well-written stuff that's out there that sounds like we're going over the same terrain. And it's not about that. It's the fact that I feel like the on the ground experiences of like doctors and nurses and techs and the people I work with, like the critical things they're going through is not getting a voice. So we've been trying to say, so one of my goals is, how do we create spaces for meaningful conversations around the challenges that perhaps we don't feel comfortable talking about, either because it involves a vulnerability that we don't want to admit to, whether it's because we have difficult language to put to those experiences, whether it's because it's going to show weakness or it's going to come out as complaining. Because ultimately, the reason why it's important is not just to have those experiences given a voice, but also it allows us to then find ways to support each other, because there are certain things, like I think what we've learned is that it's going to be hard to count on big institutions for some really critical issues. Like we have to be supporting each other. So I'm trying to think about space. When you think about a story, you're thinking about creating this world. Your world building is whether it's an emotional space, whether it's a physical space, it's a space. It's on the page, but it's a space. It lives in the mind. And so I'm in a couple of the projects that I'm currently working on with the RISD Center for Complexity is like, how do we sort of respond to complexity, and how do we create spaces for authentic conversations to take place and meaningful conversations to take place that aren't taking place because there's no space for them within sort of the confines. They don't fit in practice. They don't fit in resident conference. The nurses don't have a place for this. Like, how do we create that space? And we have a couple of things going on right now that address that. We're working through that.
That's really beautiful, Jay, and such a great way for us to be thinking about what I heard are like as three themes that have really emerged from your journey and also that of Brian and Emily as well. I heard a theme of vision. That being able to articulate your vision, and then we heard about returning to our vision as a way to re-inspire ourselves when it gets really difficult during the innovation journey. We heard a lot about relationships and teams. that some people sometimes think of the innovator's journey as a solo virtuoso artistic practice, but it's anything but. The need for diverse teams or homogenous teams at the right time with the relationships that you build that can evolve over time seem to be another important aspect of the stories that you guys told. And then the third thing I heard is just how important dialogue and conversation is. Whether you're working in the arts, whether you're working on big data sets and competencies, or whether you're working on a fundamentally new aspect to medical education, such as climate and planetary health, the conversations and the dialogue and the space for those to allow people to understand, for empathy to be expressed, so that the ideas don't just sit on a shelf, but actually can become real, seem to be a really important theme that all three of you conveyed. So I just want to thank you for this real authentic conversation. You all shared so much of yourselves, and I'm sure you only shared a little bit of the struggle and a little bit of the joy. I know both of them are part of all three of your worlds, so thanks for sharing that with us. I appreciate your authenticity and your honesty and your openness, and I'm just thrilled you spent time to think about and spend time with us today. I hope everyone on the Zoom chat feels optimistic after today. It is a difficult time, maybe one of the most difficult times in medicine, in education, and in medical education. But I hope you feel optimistic about whatever your big idea is. Innovation is a sport that cannot be done alone. And I just feel really grateful to be here at Michigan with the support of others, not only culturally and with the emotional support, but really the resources and the teams and the expertise that is quite unusual. So thank you for spending this time. And I'd like to turn it back now over to Brian Zink, who will close off this wonderful week that we've been able to spend together. Thank you to our panelists, and thank you to you all.
Thank you, Brian. Thank you,
Great.
Emily.
Thanks, Raj.
Thank you.
And thanks, Brian, George, Jay Brook, Emily Johnson. Wonderful, wonderful session, and thanks for moderating, Raj. So I'm struck with the quote that Jay gave of the Bill Moyers quote. It says, creativity is piercing the mundane to find the marvelous. There's been a lot of marvelous ideas and thoughts and streams of great creative ideas that have come out of not just a session, but the whole week. So thanks so much. I also wanted just, that the other quote in the book by Ryan Holiday, the obstacle is the way. We got lots of obstacles, but the obstacle is the way. That path is through the obstacle, and hopefully our creativity will allow us to get through, over, or around the obstacle that each of us are fighting in our work.